This is Dr. Aritra Konar, consultant interventional cardiologist, presently working at Apollo Multispeciality Hospital, Kolkata. Uh, this video is about one device. I am going to tell you in brief about a device which is called pacemaker. We all know that lot of patients are there who are having pacemaker in their chest. They are running around, moving around, and lot of patients are waiting for implantation of a pacemaker. So what is that? What is pacemaker and why it is required? Now, pacemaker is a machine which actually keeps a person's heart rate normal. That means whenever a patient is suffering from a low heart rate or low pulse rate, that person is a subset for requirement of implantation of a pacemaker. Now, why the heart rate will be low? Now, heart is a structure. Heart has an autonomous nervous system which causes the heart to beat, and it contracts and relaxes. And with this action, the heart pumps out blood to the all part of body to maintain the circulation. Now, this beating of heart, this is controlled by an autonomous nervous system of the heart itself. There is no other part of the body which is like heart. Heart is a unique organ in this aspect. So, there is a conduction system inside the heart which keeps the heart beating. At the upper part of the heart, there is a point which is called SA node. From that part, one electrical impulse is generated. That impulse from the SA node is conducted through the heart muscle to a lower portion which is called AV node. And from AV node, the electrical impulse, it actually flows and it traverses through the heart muscles to the other part of the heart. And this type of conduction system keep the heart beating continuously. Now, when age progresses, in some of the persons, this conduction system weakens, and the cells which is the cells which forms the conduction system exactly. So those kind of neural cells, they degenerate slowly, in a slow process in some of the patients. So it's a natural process. The degeneration is a natural process, but in not all the patients, these degenerations happen very slowly or very fast. So it varies individually, and in some of the persons, these conduction system cells degenerate very fast, and then the conduction slows down from the upper part to the mid part to the lower part. The conduction slows down, and then the pulse rate reduces, heart rate reduces, and so as the pulse rate reduces. So when the heart rate is reducing to an alarming level, then what happens? The blood supply to the brain is not proper. Brain should get proper blood supply to maintain its function. So whenever the heart rate is low, our normal heart rate of our body is between 60 to 100 per minute. More than 100 beat per minute is called tachycardia, which is not normal, and less than 60 beats per minute is called bradycardia, which is also not normal. Now, if the conduction system of the heart weakens and the cell degenerates, then in some of the patients, this bradycardia will be there. That means the heart rate will be slowing down. And if the heart rate slows down to 50 to 45, 40, 35, 30, so it's keep lowering and lowering, then at some point the brain will not get proper blood supply. So the patient will feel dizziness, blackouts, some visual problems, and some vertigo, some spells of blackouts, and ultimately it can lead to syncopal attacks. Syncope means loss of consciousness due to low blood supply to brain. So that is a very dangerous complication. If heart rate slows down and goes to an alarmingly low level, then the patient can have syncope and can fall down, and suddenly falling down can have some head injuries, and patient may die instantly also. So in this group of patients we need to implant a pacemaker to control the heart rate so that the heart rate doesn't go below 60. That's our target. So how to know which are the patients who needs this pacemaker? So the patient who will complain of this kind of dizzy spells, blackouts, vertigos, extreme sudden fatigability, or any loss of consciousness suddenly, then the patient should attend any cardiologist outdoor as early as possible. Cardiologist will examine his pulse rate, blood pressure, and then he will definitely do some ECG, echocardiography, 24-hour or 48-hour Holter monitoring for a continuous monitoring of the heart rate. And with these sort of investigations, we can pick up the exact reason for the lowering of the heart rate or exact reasons for the symptoms. And if we find with all these investigations and by the examination of the patients that the patient is having a low heart rate and that is causing these syncopal attacks, loss of consciousness, then instantly we should advise a pacemaker implantation because that can be life-saving procedure for the patient. So pacemaker is a very important device which saves human lives whenever the heart rate is low and the patient is having syncopal attacks. And the pacemaker insertion is a very simple procedure. It's a minor operating procedure. It is not done under general anesthesia. Pacemaker implantation is done under local anesthesia only. There we have to take an incision of only 4 to 5 centimeter in this part or right pectoral muscle or the left pectoral muscle just beneath the clavicle area, and then through this incision area we put 1 or 2 leads inside the heart, and then the pacemaker battery is like a striker of the carom game, and that pacemaker we have to implant it here and we tie it to the muscle and then we stitch it, and it's a procedure of it which takes around 1 hour time to complete the procedure, and it's absolutely safe in the good setups, the good hospitals, and the patient require only 1 or 2 days of hospitalization for the pacemaker implantation. So pacemaker, you know that pacemaker is a very important device which is a life-saving procedure. The implantation of pacemaker is not at all risky. There are very less chances of complications in a very good setup, and also it gives you a new life. So don't hesitate if you have those kind of symptoms what I have mentioned before. Instantly just come at OPD to any cardiologist and then follow his advice and get a pacemaker implanted and lead a healthy life ahead. Thank you.